We are live.
Hi everyone, this is Dr. Kumar Vadivel, board certified periodontist, and welcome to our today's episode of Truth with Teeth. And I have Reese with me here, who's going to help me let me know of the questions that have been submitted from multiple social platforms, and we are just going to get started and keep rocking. I'm looking forward to it.
Alrighty, so let's just go right ahead and start with our first question. How do you think?
Yeah, good.
All right.
Very good.
Let's start with the most popular question. It is source is Cora. The question is, does brushing your teeth without toothpaste do anything to them? How much less effective is brushing your teeth without toothpaste?
Wow, great question. That's been followed by more than 100 people. Wow, so many people have this question, huh? Okay, so the question is, does brushing your teeth without toothpaste do anything to them? And how much less effective is brushing your teeth without toothpaste? So the first part of the question is, does brushing your teeth without toothpaste do anything to them? Of course, yeah. If you have a bunch of food particles stuck on your teeth, if you are going to use your toothbrush to brush your teeth, it is of course going to help get the particles out of your teeth. So there is a reason why you want to be using the toothpaste. The reason for the toothpaste is for two reasons. One is the fluoride in the toothpaste is really good for your teeth. It's, imagine like if you're taking the toothpaste and if you're taking it in the toothbrush and if you're applying it onto the tooth, and at the same time you're kind of massaging them onto the teeth. So when you do that, that really helps to get those minerals or the chemicals on the toothpaste, which is the fluoride, get onto the teeth and the surface of the teeth. That helps kind of what we call as a remineralization. It's almost, imagine like, you know, we have the primer that we apply on the wall, or almost like a paint that we apply on a piece of metal to avoid the corrosion, or you just keep applying the primer to avoid consistent corrosion. The same thing. So you want to kind of prevent any type of erosion of the enamel. So you keep applying the fluoride over and over, and then not only just applying it, but you also, by using the toothpaste, and you are kind of massaging it onto the tooth. So the fluoride helps with the protection of the chemical protection that you need to help your teeth. At the same time, also think about washing your clothes just with water versus the soapy water, right? So the soapy water, as we learned in biology, the surface tension, right? The surface tension is what helps with removing the dirt off the clothes when you use the soapy water, versus if you're using just the water, it is still going to effectively wash the clothes, but it's not as effective. So imagine that's the kind of a difference that you're making. So the bottom line is, using your toothbrush alone, it is definitely going to help your teeth. But if you want the extra protection, then I really would like for you to use it for two reasons. To make your brushing effective, you want the frothy action and to make your brushing effective, and also the added protection of giving you the chemical protection, and the toothpaste is going to help. So the bottom line is, use whenever you're brushing, use the toothpaste, and make sure that you're going to use toothpaste that has a fluoride in it. That's going to even give you the added protection.
All right, so bottom line, toothpaste, very important. All right, let's move on to our next question, also from Quora. Let's see. Here we go. It's followed by 11 people. Which dental implant is good? ADIN or AB Dental or Noble Biocare? Why? I heard ADIN has a high failure rate, emerged on the long run after 4 to 5 years.
A great question. So the question that we have is, which dental implant is good, and by mentioning ADIN, AB, and Noble Biocare, they are referring to the several brand of implants that are available. So which dental implant is good? The answer is, for the most part, like many of the dental implants that we have in existence, and they are good. However, I can't tell all the dental implants are good, because some dental implants are researched more, or in other words, those implants have been in the market ever since the whole dental implant industry started. For example, Noble Biocare is one of the implants that reader has mentioned here, and that Noble Biocare implant is one of the first company ever started when the dental implants first came into the medical field or the dental field. So I'm not saying like Noble Biocare is the only dental implant, only best dental implant. It is one of the best dental implants, but it has been the implant which has been in the market for the longest. And then also the person also has mentioned one of the brand of implants. They said, I heard ADIN has a high failure rate, emerged on the long run after 4 to 5 years. That's a great question. So when you are getting dental implants, and it's easy as a dentist for them to give you a tooth that is going to last for a couple of years. But the goal of the dental implant is you want those dental implants pretty much to last for your lifetime. So that's the goal of the dental implant. So you want to have, you want to get a dental implant, or you want to get a brand of dental implant that's just going to stay for a long period of time, and that has been researched long enough, and that we know for sure that is going to stay for a long period of time. And I can give you a specific example. In the United States, we have the Food and Drug Administration, which regulates the quality of the dental implants. And so we have over, the last time I heard, that was over 500 FDA approved dental implant brands that are available in the United States. And you can't just say like all the 500 dental implants are good, or they are as good as the other ones just because they are approved by the FDA. Because they are approved by the FDA, that doesn't mean they have been in the market long enough. And for example, I can go start a dental implant company tomorrow, and as long as they are decent enough to be approved by the FDA will be approving it. However, that doesn't mean that I have placed those implants long enough on patients. For example, the Noble Biocare example that I gave you, the Noble Biocare has been in existence since the 1960s, or maybe even longer that I can think of. So that implant has been the longest one, and there are several others. For example, the top 3 or 4 or maybe 5 implant companies that we have in the United States are Noble Biocare, Straumann, Astra or Dentsply, and then we have Zimmer, and also we have BioHorizons. So these are the major players in the market, and they are expensive, as dental providers. And whenever somebody is placing a good brand of implants, whenever I joke with my patients, and Noble Biocare is an implant that comes from Sweden, and I joke with my patients, hey, they are just hot off of, like they come right from Sweden, and they're right off the lathe, and that's why they cost you more, and they come from Sweden all the way, and that's why they cost more. So there are several brand of implants. They are manufactured overseas, like China, Korea, or other Vietnam, and several other. Israel is one of the major players, and also so as Pakistan. So they are major players of manufacturing those dental supplies, including dental implant. So when these are manufactured outside the United States in some of these countries, developing countries, so you can just compare the quality. And again, I'm not saying like they are a bad implant. That's because they come from China or Israel or Pakistan. but they may not be not been placed in the patients, and they've not been staying in the patient's mouth for long enough, and that's the only question. That's the only answer. So going back to the question, long story short, most of the implants, the major players that I was talking about, they're as good, and you want to talk to your dentist about asking them, how long this has been in the market, and how long how often these implants are being placed. Just because a company has been in existence for 50 years, and if nobody is placing that implant, then that means they are not being tested in the patient's mouth. So you want to be able to have a conversation, healthy conversation with your dentist about, how long this company has been in existence, and how common is this implant, and how commonly this implant is being placed on patient's mouth, and what is the research behind it, and whether any controlled trials have been done for those implants. So whenever I choose my dental implants as a dental implant specialist, as a periodontist, and those are the qualities that I'm looking for, and I hope that this answers your question.
Yep, always do your research.
Thank you.
All right, let's keep going. Let's see. How do stitches dissolve in the mouth after wisdom teeth are removed?
So, great question. So, how do stitches dissolve after the wisdom teeth removal? So, there are types of stitches that we use as wisdom teeth surgeons, as dentists or a dental specialist, and we use several types of stitches. And depending on the type of stitches, there are two basic kinds. One is a non-resorbing or non-dissolving, we call it, a non-dissolving stitch, and the other one is the dissolving stitch. Non-dissolving stitch, as you know, as the name sounds, it is not going to dissolve on its own. So you need to go to the dentist's back, and you need to have that removed. And there are some reasons why we normally place those stitches, although it's not common nowadays. Sometimes we see that when I used to practice in England before I came here, and we know some of the socioeconomic status of those people coming into the hospital. They're not the best type of patient, and we want to make sure those patients are actually coming back to us to get those stitches removed. So we will intentionally place those non-dissolving stitches. But now the technology has changed, and the medical technology, and we got a lot of improvements, and ever since, and we have several stitches that are available as good as the non-dissolving stitches. Pretty much in my practice, I don't use the non-dissolving stitches. Very, very rarely I use them. But going back to the question of the dissolving stitches, how they dissolve, they are being absorbed by the body. So it's, say for example, like you have a scab in your skin. How does the scab goes away? Like, so whenever you have a wound on your body, and there is a process called inflammation that happens, and then inflammation starts to eat some of the scab away, and eventually the scab goes away. So imagine the stitch being like a small scab, or when you have the cut that happens at the site of the wisdom tooth removal, whenever there is a lot of remodeling or healing, or there is a lot of the scabbing that happens, and the stitch also get dissolved in the remodeling or the healing process, or we call it as a descaling or a descabbing process, and that's how the stitch goes away. So if you had wisdom teeth surgery or any other oral surgery for the fact in your mouth, and if your dentist or your dental specialist has placed a dissolving stitch, and that's how that goes away from the surgical site, or that's the way that dissolves from your body. And I hope that answers your question.
Very interesting. All right, let's move on. Let's see. Here we are. What are the pros and cons of within 24-hour dental implants, same-day implants?
Okay, so which one is that? Oh, 24, I see that, right, okay, all right. So the question is, what are the pros and cons within within 24-hour dental implants, or we call it as a same-day dental implant. So what the reader mean or this follower means by same-day dental implants. So there are multiple types of dental implants that are available, multiple type of, not dental implants, I should say, dental implant treatments available. So when as a surgeon, one of the most common reasons why I place dental implants is whenever the patient is going to have a missing tooth. So if I remove a tooth, my goal is to immediately place an implant on that tooth, except for wisdom teeth, of course. So after the removal, as soon as the tooth is removed, and if the site is good enough, what I mean by is, sometimes there is a lot of infection around the tooth, or there is not much bone around the tooth, and so we may not be able to place the implant. So we are placing the implants immediately on the site, the tooth surgical site. What they mean by the 24-hour dental implant or the same-day dental implant is that's exactly what they mean. So you remove the tooth, and at the same time or on the same day you place the dental implant. That can be done for one single tooth, just like I mentioned. You remove a tooth, for example, like a back tooth or a front tooth, whichever tooth, and particularly on a front tooth, you don't want to be walking around with no tooth at all. So you want to remove the tooth, and you want to put the implant, and you want to even put a crown on the same day. That way you don't feel like you have a missing tooth at all. So there are several occasions, and we are able to remove the tooth, put the implant in at the same time, and put even a fake tooth on the top of that at the same time, although it could be a temporary fake tooth to begin with. So that's what those are called, the same-day dental implant. And what they may be referring to is the same-day dental implant. Does not mean like same-day dental implant. That also may same-day teeth. So you may be hearing to advertisements and then commercials on the radio and the TV. People are referring to same-day teeth. So like I said earlier, you remove a tooth and you put an implant, and then you put on the tooth on the same day. So that means not only the same-day implant, but also it's called a same-day tooth. But imagine you're losing multiple teeth. For example, one of the common procedures that I do in my office when patients have a like a complete set of bad teeth, completely mutilated mouth, so completely bad dentition on the bottom, completely bad teeth, set of teeth on the top. So we are often removing sometime, as many as about 16 teeth in the bottom, as many as about total of 32 teeth, 16 on the top and 16 in the bottom. Then we remove all the 16 teeth on the top, remove all the 16 teeth on the bottom, and then now we are putting in the same-day teeth. So now we are screwed. So that's what most people are referring to when it comes to the same-day dental implants or same-day teeth. And then the pros and cons of those. So the pros and cons, who would not want to come into my office and have a broken tooth, and then they are going to walk out with a fake tooth that looks, feels, and functions like a natural tooth, right? So those are the pros, and those are the pros. So absolutely, there are many advantages. Although I don't recommend you for example, you get a front tooth in my office and immediately walk out of my office, and then you're going to eat the corn on the cob or on an apple. I don't recommend you do that. But for the most part, just going to look and feel for like a natural tooth, at least on the healing period, the same day. But it's just going to start functioning like a natural tooth when it comes to like the 3 months healing period, which is the normal time of the healing. So those are the absolute pros. And then, sorry, one more pro I forgot to mention. Imagine that patient coming in to have all 16 teeth removed on the bottom, all 16 teeth removed on the top also, and walking out a complete set of teeth, same-day teeth. Imagine what else you can expect. That's how much the medical technology has advanced, the dental technology has advanced, and we are able to offer the same day complete set of teeth to our patients using this technology of same day teeth. So those are the pros that you can think of. The cons, well, like not every single time that we are able to guarantee that we are able to place the fake tooth on the top, like we talked about earlier. So you got severe infection. You have seen that reason in our practice. You got severe infection, or when the tooth comes out, so you got so much of bone destruction, and the bone actually came along with the tooth at the time the tooth came out. Or patients fell down and then they just not only broke the tooth, but they also broke the bone around the tooth. When those situations happen, we are not able to place the implant. Sometimes if we are able to place the implant, but we may not be able to place the fake tooth on the top of that. So those are the cons of the same-day teeth. And then sometimes we do tell patients that other biggest problem that we have is one of the common, we joke in the dental industry, most patients come and say, oh, I was eating on a piece of bread and the tooth broke. But actually they were eating like just they're trying to crack a nut. I'm not saying like, my patients are lying to me, but that's kind of like, one of the things, like, they may not be paying attention to what they are not supposed to be doing. For example, if I'm going to give you tooth, when a front tooth breaks, if I'm going to give you a front tooth implant and if I'm going to give you a fake tooth on the same day, I'm going to expect you to be careful not biting into an apple or not biting into a corn on the cob. But if you go home and then either you try to do it or you unintentionally you forgot and then you just try to grab onto something like that, then it's just going to break. So those are the cons that I can think of. And then sometimes like it's patients are kind of really trying to push the limit, and they have whatever the case may be. Whenever we are trying to place the implant, sometime so we think like, well, I think the implant is going to be okay, and then we try to push the limit and then see whether the Mother Nature will forgive and be a little forgiving and to try to make that implant heal. And then sometimes the implant does not heal, and so sometimes you may have to remove the implant and replace them. That is, it's not like really a cons, and though it's not a problem, and it's just going to delay the treatment time. So that's pretty much like, there are more positive things on these same-day dental implants and same-day teeth versus really problems. So anybody who's going to be missing a tooth, you're needing a tooth extraction, or you're going to be losing either one tooth or multiple teeth, and are you a good candidate for a same-day dental implant or same-day teeth, I would strongly encourage you go talk to your dentist, and then, or if you're in the Dallas-Fort Worth area, come back and see us and we can definitely help you. I hope I answered this question for you.
It sounds like there's a couple different factors for whether you can get a same-day implant or not.
Absolutely, yes sir. Yeah.
All right, let's keep on going. Let's see. Alrighty, next question. Is your gum disease over if the bleeding stops? Can gingivitis happen without bleeding?
Where are we here?
We're just gonna be right up.
Oh, right here. Okay. All right. Okay. So the question. This is from a Quora follower right here. Is your gum disease over if the bleeding stops? Can gingivitis happen without bleeding? Okay. So just because the bleeding stops, that doesn't mean that you don't have gum disease. So there are several signs of gum disease, and we talk to our patients as gum specialists. We talk to our patients all the time. What are the signs of gum disease? You have gum swelling, you have bleeding, you have bad breath, and you have bone loss, and you have mobility, and you have tartar, you have plaque. And so those are like about 6 or 7 things, or maybe even more things that we look for whenever we evaluate for a gum disease. So just because you don't have bleeding, don't think that you don't have gum disease. For example, this is one of the common things that I go through with my patients who are smokers, and also not only the cigarette smokers but also the vaping people. So think about this: anytime you are smoking, and the tobacco plus the heat, it constricts all the blood vessels. So particularly the smokers, they have no clue that they have this gum disease, because they are thinking somebody told them, just like this follower is asking here, oh, I don't bleed, I never thought like I had gum disease. Oh, you're never going to bleed, because from the smoking and from the heat you're going to have all those blood vessels constricted, and so you're never going to have a problem with the bleeding. But you have very advanced gum disease on a scale of 1 to 10, you got 20 out of 10, but you still don't have bleeding. Yeah, so that could be a problem. So don't think just because you don't have bleeding that is a stop of the gum disease. You may still have gum disease. Either you started with some bleeding, you got some treatment, and now you think just because the bleeding has gone away then you don't have gum disease, or just because you don't have any bleeding at all to begin with, don't think that you never had gum disease. So it could be absolutely false, and then that could be like kind of misleading. So make sure that you're going to go back to your dentist and have them evaluate for all the signs that I talked about, like the bad breath, tartar, plaque, pocket depths, or the bone loss level, and they may even have to take some x-rays, and all of those things they have to look for. And then the second part of the question is, can gingivitis happen without bleeding? One of the common signs of gingivitis is bleeding, but can the gingivitis happen without the bleeding? Yes, the answer again is going back to the previous question that we had, but the previous part of the question that we had. Again, you could be a smoker and you may not bleed as badly, and you may have other factors going on, and you may not bleed as badly, but you may still have some gingivitis. So the bottom line is, if you have gum disease and if you don't have bleeding, you may still have gum disease. So the right answer is, make sure that you go back to your dentist and get your routine cleanings done. And for most people, the cleanings have to be done every 6 months for people with gum disease, and we recommend, as dentists and dental specialists, particularly as a periodontist, I recommend a periodontist or a gum specialist, I recommend all my patients to get their cleanings done every 3 months. And as a periodontist, what I do to take care of my teeth, and this is one of the most common questions that my patients ask me, how often do I get my cleanings done? Well, I got a luxury here, and I have a hygienist right in front of me almost every single day. So I get my cleanings, as as often as about every 6 weeks, or sometime when there is a reschedule happens, and when I see my hygienist is kind of looking for opportunities and she's not doing anything, and if I have my patient reschedule or my patients move, my schedule changes, then immediately I get on the chair, and sometimes I'm getting cleanings as often as about 4 weeks. And then on the top of that, I'm brushing, flossing, and I'm also doing other things. And patients ask me again how many times I brush my teeth, and I brush my teeth 6 to 8 times a day. So there are many things that you can do. So the bottom line is, make sure that you're going to go back to your dentist to check and make sure that you don't have gingivitis or any other signs of gum disease.
Yeah, it sounds like you could have a problem, not even know it.
Yes, sir.
All right, let's keep going. Right above that, which is the best option to replace missing teeth? Bridges, dentures, or implants? Why should a person get a dental implant rather than just dentures or a bridge?
Great question. So the question is, which is the best option to replace missing teeth? Bridges, dentures, or implants? And the second part of the question is, why should a person get a dental implant rather than just dentures or a bridge? So no questions asked. So dental implants, in my opinion, are the best possible option. Do you have the other options also? Can you get a bridge instead of a dental implant? Can you get a partial denture instead of dental implant? Can you get a regular denture instead of a dental implant? Of course, you can get anything you want. However, what is going to be the standard of care? What's going to be the luxury? What is the trend? That's what the question is. Let me ask you these, guys. Okay, so whenever you have the option to have a phone, and what is the trend? Most people want to go buy an iPhone. That's the trend in America. What is the most common Android phone? Well, one of the best-selling Android phone is, top 2 or 3 brands you can think of: Samsung, LG, or one-to-one, whatever the case may be. So these are the top notch, and then they all kind of share the common feature. So they are one of the best of the best of the kind. Then they are all smartphones. Okay, right? But think about this: you can get anything of a smartphone nature. But what we are referring to here is the dental implants being the smartphones. If you think that you don't have the budget to get an iPhone, you may go get a regular phone. So if you don't have the budget to go get the dental implant, the best possible kind we talked about earlier, so of $3,000-4,000, you may go to a dentist who is offering a dental implant for $2,500 or $1,500. That's kind of like buying a smartphone but a different brand. However, if you are going to get a denture or a partial denture instead of getting a dental implant, it's like getting a flip phone. So let me ask you this: if you are using a smartphone, if you're actually watching this streaming today, the live video today on your smartphone, let me take the smartphone away from you. You wouldn't be even watching my video if I did that, right? So for most patients, this is exactly what I tell them. So if I take your smartphone away, and if I'm going to give you a flip phone, how would you like that? So that's not the trend, that's not modern, and that's not what the technology is. So if I'm going to take the flip phone away, then you're not going to like it, and that's exactly what it is, and most patients don't like it, and that's exactly what a partial denture is. They don't like it. So that's the reason why, so you don't get a partial denture. You want to get something trendy, and you want to get something that is going to last for a long time. So you want to get something that's the dental implant. So how are the dental implants compared to the bridges? Think about this. So you want to do something and that is easily reversible, and you are not going to cause more damage, and you want to do what we in this day and age we talk about, like what we call as a minimally invasive procedures. So if you want to have a surgery done in an abdomen, so you want to you're a surgeon to put a small keyhole and to do the procedure, versus completely opening your belly, what we call it as a minimally invasive procedure. Think about that. So the same thing, you want anything to be done in your body or anything to be done in your mouth, and you want that to be minimally invasive. So if you have 3 teeth like this, and then you have one of the tooth missing in the middle, the only way that you can get a dental bridge here is to cut the 2 teeth on either side, and then you grind them down, and then you solder them down. Now you're going to get a bridge that's going to be on all 3 teeth together like that. Now with the dental implant, you don't have to ever touch those 2 teeth on either side. So all you have to do is minimally invasive, just like I mentioned here. All you have to do is make a small hole here, put a channel, make a channel in the bone, and put an implant in the middle. Now you get a tooth in the middle, and you don't have to ever touch the 2 teeth on either side. So the question is back to you. So whenever you have something going on in your abdomen, you want your belly to be completely cut open, or you want your surgeon to place a minimal hole and make it minimally invasive, and you already know the answer, and you're not going to let anybody cut your belly open if there is an option. And that's exactly what the dental implants are. They're minimally invasive, they are going to last for a long time, and they are very safe, and then they have very minimal recovery time just compared to any other minimally invasive procedure. And then the second part of the question was, why should a person get a dental implant rather than just dentures or a bridge? I think I pretty much answered all the questions, and so it is, although it is a 2-part question, the answers kind of go along. So no questions asked in this modern age, and absolutely no questions asked. Dental implants are pretty much the best, and in my opinion, anything you do, try to do a bridge or try to do a bridge particularly, it's pretty barbaric because you're going to completely solder down the two good teeth, and I would never do that to any one of my friends or family, and I will never do that to one of my patients unless there is a really no option at all. But I still recommend you still get the dental implant. To try die hard to save your teeth and get a dental implant. And I hope I answered this question.
Yeah, so if you're investing in your teeth, you want to get the best option.
Absolutely, yes sir. Yeah.
All right. Let's do a question from our website, actually. It comes from Katrina Eliza 86 at gmail.com. The question is, how can I qualify for low-income assistance for dental implants?
So how can I qualify? The question is, how can I qualify for low-income assistance for dental implant? So I'm not sure whether the reader is, this follower is referring to if she's on a low income, whether she can qualify for a dental implants, or she's trying to see how she can fit the dental implants into her budget. If she is on a low income assistance, and like for example, like I'm just going to name something, if she's on a Medicare for a Medicare plan, for example, and there are some Medicare plans which are the low income plans, and they are not going to be able to cover dental implants under their plan. So unfortunately, my hands are tied as far as what I could do to help those kind of patients. However, before I go to the next part of the question, so I'm just picking Medicare as an example. So there are many plans, not just Medicare, and I do have a lot of good plans. The patients come from great employees, and they still have a great plan. For example, I have federal employees. They have $20,000-$30,000 in coverage from the federal government, but they don't have dental implant coverage, or even if they did have implant coverage, the coverage is only like about 20%. So if you have a $10,000 treatment that needs to be done, 20% is only $2,000, and then you still have to come up with about $8,000 out of pocket to get the treatment done. Or if you have a plan that does not cover dental implants at all, zero, so then you are out by $10,000. So if you have a plan that is either a low income plan or a plan that is not going to assist you with the dental implants, then your investment is going to be very high. However, going back to the second part of the question, what we talked about earlier, if you are somebody who are looking for some kind of a budget options to make it fit within your budget and the lifestyle, we offer multiple payment options to our patients. I'm not going to say every single patient that is going to come into my practice would be able to qualify for those type of treatment, but we are able to help many patients that other offices, dental offices, they were not able to help, and then we were able to come up with some creative plans or creative plans that are going to fit their budget to be able to help them. For example, in my office, we offer about 3 or 4 different banks that we work with, and then we have high-end, medium income, middle income groups, and these the top 3-4 banks that we normally work with, they qualify them. But we do have some low income group, and these top 3 or 4 banks, they are not able to qualify for those people. So now we have other banks that we work with for those people with the low income. We have other payment options or other bank options that we are able to work with. So the long story short again, to answer your question is whether you're going to be able to qualify for a dental implant, or whether we can help you or your dentist can help you fit this into your budget and lifestyle. That would be a great question for your dentist. So have a honest conversation with your patient when you go back to your dentist, or when you come to our office, and just let us know what your credit score is, or what is your budget. So then we should be able to let you know whether this is something that we will be able to help you within our power. and we look forward to seeing you if you're in the area in our office, around our office. Yeah.
Yeah, we're always willing to help our patients out. All right. Let's see. Next question. Do you absolutely need a crown after a root canal? I had a root canal in 2010 and I didn't get a crown, just a permanent filling. The tooth has been fine ever since, but every dentist I've met keeps urging me to get one.
Great question. So to repeat the question, do you absolutely need a crown after a root canal? I had a root canal in 2010 and I did not get a crown, just a permanent filling. The tooth has been fine ever since, but every dentist I have met keeps urging me to get one. Okay, so not every single tooth that gets a root canal needs a crown. Not every single tooth that you had a root canal that had a filling may or may not need a crown, but it may not be fine after a period of time. So let's look at the reasons why you need a crown after a root canal. So for a front tooth, for example, after you get the root canal, sorry, let me back up a second. So anytime you get a root canal, after you get the root canal, the belief is after you get the root canal, the tooth becomes kind of really brittle. So when it becomes brittle, the chances for that to crack is really high. That's the reason why we want to give you some added protection, and we want, after you get the root canal done, we want your teeth to be lasting for a long period of time. That's the reason why we want you to get a crown. For example, on a front tooth, we don't normally recommend getting a crown because you don't normally do a lot of chewing with the front tooth. So you really don't need always need a crown following a root canal for a front tooth. However, on the same token, if you're going to get a root canal done on a back tooth, and we strongly recommend you get a crown, because you don't want to break the tooth because you're already chewing and you're putting a lot of force. Now the tooth becoming brittle after you get the root canal, because after the root canal you lose all the blood supply to the crown and blood supply to the tooth, and that makes it really brittle. Now that's the reason why you want to get a crown. So going back to this follower right here, so you did fine for several years, you said, right? So that is absolutely true. So the question really becomes, do you want to really keep the tooth for 10 years? That's several years, could be 10 years, in your opinion. But what the dentist may be thinking is they want this tooth to last for 20 years or 30 years. Or they may be seeing there is a small crack that is happening on that tooth, and then now they're urging you, hey, if you let this go, now the chances of that tooth cracking is even higher, particularly with the root canal that you already have, which is already making the tooth brittle. Now you have a higher chance of cracking your tooth. So I'm thinking that's one of the reasons why the dentists have been saying, and I'm also thinking if it is a back tooth, then there is a very good chance that they are telling you that there is a reason why you need a root canal. Hey, at the end of the day, all we are concerned about, we are in the business of helping patients, and we want our patients to keep this tooth for a long period of time. Whenever this is a conversation that I have with my patients when they come to my office. Hey, you and I are going to be friends for a long period of time, possibly the rest of your life. And then, well, doc, I don't want to see you in this situation, but I really want to see you. That's what they say, So we want to be able to help all our patients, and any dentist for the fact, we want to be able to help our patients keep their teeth for a long period of time, and that's our goal. And there is nothing personal. And so I'm sure all the dentists that you met with, and they probably for the same reason they told you needed to get a tooth crown for those, particularly if it is a back tooth, and that will help you keep your tooth for a long period of time. And I hope I answered this question for you.
Yeah, if your dentist is recommending something, probably a good idea to do it.
Absolutely, yes, sir. Yeah.
All right, let's keep going. Is getting a dental implant necessary? Can it be avoided by leaving a gap between teeth? What are the harmful effects of leaving a gap?
Great question. Is getting a dental implant necessary? Can it be avoided by leaving a gap between teeth? What are the harmful effects of leaving a gap? So let me ask this question. If you lost tomorrow, if you end up losing this front tooth right here, how comfortable are you just going around with the front tooth? How about you, Reese?
I would not be comfortable at all.
Yeah, well, how about you sitting in there in the front desk right here and you don't have a tooth? We don't.
I don't think the patients would be very comfortable
Absolutely,
with that.
the patients won't be comfortable, right? So think about him. Think about him, being a server in a restaurant. How many people would feel comfortable like if he does not have a tooth? And think about you. How would you feel? Whatever job that you're doing, how comfortable would you feel around your customers or your friends or your family members to not have a front tooth? So there is the answer. So you definitely don't want to have a gap, particularly if it is a front tooth. How about a back tooth? So how comfortable are you having a gap in your back tooth? That depends on the how comfortable again are you and not being able to chew on one side, right? So if you want to be able to chew on properly on both sides, then you definitely want to have a dental implant that's going to help you chew equally on both sides. And then what are the adverse effects of leaving the teeth on the back? So think about this. So whenever you have 3 teeth like in a row, for example, and then you have 3 teeth on the top, for example, in a row. So when you don't have one tooth in the bottom, so the top tooth is going to start to come down. So imagine if it is a bottom tooth that is missing, for example, the gravity is going to stop pulling the top tooth, and now the top tooth is going to come down. And also imagine if you have 3 teeth like this straight in a row, and now the bottom tooth is missing, one of the bottom tooth is missing. Now imagine what's going to happen to those 2 teeth. They are going to start to slide towards each other. So they are going to move. And this is one of the common things that I ask my patients. Hey, do you drive a car? And if you do drive a car, and think about just having a 4th set of tires, then you just changed about a few months ago, and if you don't align it properly or if you don't balance it properly, think about 6 months later what is going to happen. So one tire is going to wear out more than the other, right? Or you're going to keep driving and you don't check it out properly, then 6 months later, guess what? Either you're going to get stranded on the highway because you did not check it properly, or 6 months later that 2 tires are completely out. You may end up even changing all 4 tires because you did not pay attention. Same thing. So if you don't have teeth that are kind of balanced, so you have one teeth, the teeth are missing, on the other side all the teeth are there, now you're going to wear the teeth on the good side more than the other side. And then think about this, we are not just talking about the teeth, but also the face sinking. How many of you guys, particularly ladies, how many of you guys feel comfortable leaving a back tooth here? Now the face is going to start sinking, right? So you don't want to have that, because when the tooth is going to start shrinking, the bone is going to start shrinking. Now your face is going to start shrinking because you don't have bone, right? So now that's going to be a big problem. And then imagine, this is one of the biggest problems they don't realize. As you're younger, now you're able to adapt because you have the joint, what we call it as a temporomandibular joint, or the jaw joint right here. So they depend on a good balance of your teeth, because whenever you bite like this, so you can feel the pressure on the joint right here. So imagine you have a complete set of teeth on one side, they're very good, and now they're not going to put a lot of pressure in the joint. Now on the other side you don't have many teeth, now you have a lot of missing teeth. Now your teeth are not always struggling to find a good position, so now you got a problem in the joint. So not only you are creating problems for your teeth and then the face sinking, but also you're creating problems with the joints. These are kind of minor things, and when patients come in, we are trying to educate them what are the possible problems that could happen. So the possible problems that you can think of from a missing tooth, it could be a tooth problem, it could be a face problem with the face sinking problem, or it could be an aging problem, or it could be even the jawbone function problem. So there are multiple things that can stack one on the top of the other by just having a simple missing tooth. And I hope this answers your question.
Mm-hmm. Sounds like it's really important to keep your mouth balanced and equal.
Absolutely, yes sir. Mm-hmm. Right, just like driving a car, just like we talked about, right? Yeah, you got to make sure that you're going to balance your ties if you want to last them longer, right?
Mm-hmm. All right, let's keep going. What are some possible negative side effects of having wisdom teeth removed?
So the question is, what are some possible negative side effects of having the wisdom teeth removed? The only risk of, I shouldn't say the negative side effect, or I should say possible risk of getting the wisdom teeth removed. Anytime we are doing any type of surgical procedures in our office, my patients ask me, hey, what are the possible complications that could happen by removing the wisdom teeth? And I'm going to tell them, well, there are like about 20 or 30 different things that could happen: pain, swelling, infection, jawbone deterioration, and you may end up going to the ER, or you may get some bleeding, and all of those. Like, there are multiple things could happen, and the odds of this happen is very, very unlikely, particularly if you're getting a procedure done in a specialist office like us, or an oral surgeon, or a periodontist, or a dental implant specialist, and the odds of any type of complications happening is very unlikely. But there are possible complications that could happen. One of the most common things that most patients are afraid of, that they're like, I want to classify those complications as a short-term and a long-term. Short-term, most people, whenever they're asking, hey, I heard about dry socket, you could have a dry socket happen, and so what are the odds of that happening? So be it, like if you did have a dry socket, there are means to treat it, and you're going to get, you're going to probably be having a little bit of a longer recovery than any other patients, and you're going to be fine. If you had pain, infection, fever, bleeding, all those things are very easily manageable. That's mostly not a problem at all. One of the most common problems that we come across, and that's a little bit of difficult to manage, is a nerve injury after the wisdom teeth removal. So some patients, if the wisdom teeth are kind of wrapped around the nerve, or the nerve is too close to the wisdom tooth that being removed, or sometimes accidentally things can happen, and for some unknown reasons, or just from injecting the local anesthetic or injecting the numbing medication. So you may have some altered sensation to your lip or the chin, or maybe even some altered sensation to your tongue, which means you may have some numbness on your chin or the lip or the tongue. For most patients, again, this numbness may be temporary. About 99% of the time, the numbness kind of goes away. On less than 1% of the time, this numbness stays permanently, depending on the age, whether you have any other higher risk, or how close those wisdom teeth were, how proximal those wisdom teeth were to the nerve. So there are multiple reasons why it happened. Sometimes, like I said, for unknown reason, this happens also, just from injecting the numbing and other sort of things. So those are some of the side effects that I can think of, what we call it as the complications. Not necessarily it is going to happen on every single patient, and not that something I would guarantee that there is not going to be any complications at all, because any complications can happen to anybody. So one of the most common things that we kind of like concerned about, which sometimes become permanent, will be the nerve damage. But other than that, most of the problems are very easily manageable, and I don't think you should be worried about whether you are at risk of having any type of nerve damage. And that's a great question. And you should be talking to your surgeon, or you should be talking to your dentist about that, whether you're at a higher risk compared to anybody else. And I hope that answers your question. Thank you so much.
All right, so it looks like there's time for one more question. So let's see. Here we go. This is the most popular. Next up, how can you dye from a cavity?
Great question. So how can you die from a cavity? So can you die from a cavity? Let me rephrase the question. Can you die from a cavity? Absolutely yes, you can die from a cavity. How can you die from a cavity? There are multiple reasons you can die from a cavity. Okay, so most people probably aware of that, particularly in the US, and there was recently, this was in the news, this young dad who is a father of a 3-year-old, he died of a dental abscess. What a dental abscess is a pus pocket that formed on the tooth, and the dad died, a father of this 3-year-old died because he had a dental abscess, and that's what was in the news. How did the dental abscess happen? So the dental abscess happened because the patient had a cavity to begin with. That's exactly the reason why the cavity, that's exactly why the dental abscess happened, because of the cavity. So the dental cavity or the tooth cavity, that causes, if it is an ongoing process, that causes infection. The infection spreads. When the infection spreads and it keeps spreading, and sometimes the infection cannot escape into your mouth or any other parts of your body, that keeps growing. And today, for example, I had a patient who had infection. His jaw was like swollen like this. So I had to really remove the tooth with the big cavity, and the moment that I removed, the pus pocket was just pouring out, kind of gushing out a lot of pus, and his swelling went down from here to all the way down as soon as I removed the tooth, because we removed all the pus from the site. However, going back to the question we had, so the cavity causes infection. The infection start poisoning your body. If it is a localized poisoning, that you may be okay, but still it is going to take a lot of time for the poisoning to happen to the whole body. Then you may have a localized problem, and it may take some time for the infection to show up. However, if the poisoning starts to happen for the body, then this is going to travel into your brain, and this is going to travel into your heart and the lungs and kidneys, and the whole body poisoning is going to happen. And the long story short, can someone die of a cavity? Yes, because the cavity is not like it may not be the direct reason why you're going to die, but there are multiple reasons, like the other question that we had. What are the complications of a cavity, or what is the worst complication of the cavity is a death, and that could happen from a cavity. So if you have a cavity that you're concerned about, or if you know that you have a cavity that you have not taken care, then there is an absolute reason why you should be seeing your dentist. Whether that cavity needs to be taken care or not, that's the question that you need to ask your dentist. But please make sure that you don't have cavities that are leading to life-threatening situations like this. And there is absolutely no reason you should be letting a cavity go, which is going to particularly make this life-threatening situation happen, and there is no reason for doing that. And I hope answers this question. Yeah.
All right, so it looks like that does it for us tonight.
Oh, thank you so much, guys, and we are 8 o'clock now, so we are on time. And thank you so much all for listening. And this is our, I believe this is the 5th or the 6th episode of our Truth with Teeth show. And Reese has been a great help. And then here we have answers for all the questions that you have. Any question patients ask me, like, sometimes submit, oh doctor, I know this is a stupid question. There is no question as a stupid question. So anytime you have a question, please feel free to submit these questions, and we have multiple followers, and we have through multiple social media. We have our website, implantsgumcare.com, or we have our truthwithteeth.com website, and then also we have Quora, Facebook, YouTube, and what is the Reddit, and Instagram. So we are on the facial media all over. So look for either Implants and Gumcare, Carrollton, Texas, or Implants and Gumcare, Dallas, Texas, or look for Dr. Kumar T. Vadivel, Vadivel DDS, and our name should immediately pop up on Google. And we look forward to answering many questions for you guys. And don't hesitate to answer any, don't input any questions. And we look forward to really meeting with you for the next time. Until then, bye for now.